Hello friends, in this video now I am going to take the detail of the metabolism of two aromatic amino acids, that is phenylalanine and tyrosine. So let's get started. I told you phenylalanine. See the structure. The structure is, first I am making the common structure and then here one hydrogen. So in the side chain of phenylalanine, see the name contains alanine. So in the side chain we have alanine structure, right? Write down first alanine structure and then see the name phenylalanine. That is, phenyl ring is attached to alanine. So the structure is very simple, that in the structure of alanine you make the structure of phenyl ring here. So that is the structure of phenylalanine, right? I have not taken care of valency here. It doesn't matter. We are not concerned with valency here. So just see, the easy structure to be made is first make alanine and then make phenylalanine. That is, add phenyl ring to it. So this is the structure of phenylalanine. So from the idea of the structure, you can tell that this big side chain cannot be made in body. So we require it in diet. That's why this phenylalanine is considered essential, right? And it is non-polar because these rings, phenyl ring, benzene ring, these rings are non-polar. So phenylalanine is essential and non-polar, right? Now the other aromatic amino acid tyrosine is synthesized from phenylalanine. So from phenylalanine tyrosine is synthesized with the help of enzyme here, that is phenylalanine hydroxylase. Phenylalanine hydroxylase enzyme, short form I'm using PAH, phenylalanine hydroxylase. So this enzyme is making tyrosine. You know that in these hydroxylation reactions only one atom of molecular oxygen is added because these are monooxygenation reactions, and then tyrosine is formed here. But now in the structure you can see the group added is OH group added. That's why these enzymes are known as hydroxylases, because you can see OH group added. So in the structure of phenylalanine, now you add one OH group here. So again, first I'm making alanine, then phenyl ring to this alanine, then here at this position you add OH. This is the structure of tyrosine. Now in the structure of tyrosine, OH group is there, that's why it is polar, and tyrosine can be synthesized from this enzyme phenylalanine hydroxylase. In the body it can be synthesized from phenylalanine. That's why tyrosine is non-essential amino acid, right? So it is non-essential and polar, but there is a controversy for the polarity of tyrosine, that some books will write that because of phenyl ring it is non-polar, but some books will say because of OH it is polar. So it is the controversy, because sometimes this amino acid is behaving as polar, sometimes it is behaving as non-polar. So here there is a controversy, and for controversies I already told you that you have to do it according to the question. So according to the question you will be able to solve once you know it is a controversy, right? So this is done here, that is phenylalanine is essential and non-polar, tyrosine is non-essential and polar here, right? Now let's see the detail of this reaction of conversion of phenylalanine to tyrosine. So from diet we are taking phenylalanine. We are taking phenylalanine in diet. It gets converted to tyrosine. Here the enzyme is phenylalanine hydroxylase. I'm just using the short form PAH, phenylalanine hydroxylase. This reaction requires oxygen, and here tetrahydrobiopterin is used. Tetrahydrobiopterin is converted to dihydrobiopterin. So it is tetrahydrobiopterin is converted to dihydrobiopterin. Now again we have to replenish this tetrahydrobiopterin. So now this dihydrobiopterin will be converted to tetrahydrobiopterin, and here we require reducing equivalents, or hydrogen we require. That hydrogen is coming from NADPH. So NADPH gets converted to NADP, and the name of this enzyme is dihydrobiopterin reductase. Dihydrobiopterin reductase enzyme here. And now what is the source of this tetrahydrobiopterin? Tetrahydrobiopterin is derived from GTP with the help of enzyme GTP cyclohydrolase GTP cyclohydrolase enzyme is involved here for the formation of tetrahydrobiopterin from GTP, right? Now, deficiency of this enzyme, phenylalanine hydroxylase deficiency, will lead to phenylketonuria, also called classic phenylketonuria or phenylketonuria type 1. Right? And the deficiency of this enzyme, dihydrobiopterin reductase deficiency, also leads to phenylketonuria, which is called non-classic phenylketonuria. Non-classic phenylketonuria or phenylketonuria type 2 and 3. Right? Now, deficiency of this enzyme, GTP cyclohydrolase deficiency, will also lead to phenylketonuria. This is also non-classic phenylketonuria or type 4 and type 5 phenylketonuria, right? So we have done this enzyme phenylalanine hydroxylase. This enzyme phenylalanine hydroxylase is there. There are two more aromatic amino acid hydroxylases, that is tyrosine hydroxylase. So one amino acid is phenylalanine hydroxylase. Then another amino acid, another aromatic amino acid is tyrosine, so it is tyrosine hydroxylase. One more aromatic amino acid, tryptophan, and the enzyme is tryptophan hydroxylase. These are three aromatic amino acid hydroxylases and they are similar. These three are similar in that they all require tetrahydrobiopterin and they all require NADPH. So these two things are required, tetrahydrobiopterin and NADPH required for all the aromatic amino acid hydroxylase enzymes, right? Now let's do the detail of this classic phenylketonuria. Classic phenylketonuria, PKU. This is the most common metabolic disorder of amino acid. Most common metabolic disorder of amino acids. This phenylketonuria is autosomal recessive. You know the enzyme deficient is phenylalanine hydroxylase, and here what is happening, which reaction is not occurring? Phenylalanine to tyrosine conversion is not occurring, and so can I say that tyrosine becomes essential in this disease? Because normally tyrosine can be synthesized from phenylalanine, but now tyrosine cannot be synthesized in body, so tyrosine becomes essential. So in the treatment of this disease, we have to give tyrosine to these patients, right? And you know that tyrosine amino acid will form the pigment melanin, and when tyrosine is not getting formed in this patient, then pigment melanin is not formed. So these patients also have hypopigmentation. They have hypopigmentation, that is these patients have fair skin and blue color eyes. Fair skin and blue eyes, right? Also, phenylalanine is getting accumulated because this step is not occurring. So the substrate accumulates, phenylalanine accumulates. Further, phenylalanine gets converted to phenylpyruvate, phenylactate and phenylacetate. So all these compounds are getting accumulated in this body: phenylalanine, phenylactate, phenylpyruvate and phenylacetate, right? So clinical features of these patients, clinical features, the body odor of these patients is mousy or musty odor of body here, which is because of the compound phenylacetate. So you have to learn this, that phenylacetate is responsible for the mousy or musty odor of body in these patients. And tell me, is brain affected in this phenylketonuria? Yes, severe mental retardation occurs. Brain is affected and severe mental retardation occur, and mainly this mental retardation is because of which compound? It is because of the amino acid itself, that is phenylalanine, right? And in these patients, for diagnosis, there is a simple ferric chloride urine test which is done. Ferric chloride urine test will give positive color, positive test will give green color. This ferric chloride urine positive test is because of which compound? It is because of phenyl pyruvate which is coming in urine. Let me tell you, pyruvate is a 3-carbon keto acid. It is a 3-carbon keto acid which is coming in urine. So that's why the name of disease is phenylketonuria. That is, some phenyl ketone is coming in urine, that is phenyl pyruvate is coming in urine. Earlier when they discovered this disease, they found that keto acids are coming in urine of these patients who are mentally retarded also. They have hypopigmentation. So they named the disease phenylketonuria. Some phenyl keto acids are coming in urine, right? Now, other tests which are positive in these patients are DNPH test is also positive. Then bacterial Guthries test, bacterial Guthries test, it is done here, also called bacterial inhibition test, that is positive in these patients, and the bacteria used is Bacillus subtilis. And screening of these patients are done by these tests, but screening should be done after 2-3 days of life, after 2-3 days of birth, because at birth, like within first 2 days of birth, because of maternal enzyme which is normal, because of maternal enzyme, levels are normal. So levels will be decreased after 2-3 days only. So screening of these patients is especially done after 2-3 days, right? There is one term, maternal phenylketonuria. There is one term, maternal phenylketonuria, maternal PKU. This is because of lack of proper diet during pregnancy. This is lack of proper diet during pregnancy, that the child born will be having microcephaly, mental retardation. In maternal phenylketonuria, child has microcephaly, mental retardation, growth retardation, and congenital heart defects also are found in maternal phenylketonuria, right? Now, you know that brain is affected in these patients. Let's see the reason why brain is affected in these patients. One reason is decreased neurotransmitters. And why decreased neurotransmitters occur? Because there is excess of phenylalanine in blood. I told you, phenylalanine is getting accumulated. Excess phenylalanine in blood is taken up into the brain cells. It will go into the brain cells, and brain cells keep uptaking phenylalanine from blood. That brain is not taking tyrosine and tryptophan from blood. So tyrosine and tryptophan from blood are unable to reach brain cells. So deficiency of tyrosine and tryptophan in brain. You know that tyrosine will form catecholamines, so they will be decreased. You know that tryptophan will form serotonin. So all these neurotransmitters are decreased in brain. Also, there is decreased thyroxine. So decreased thyroxine in these patients. So because of these reasons, there is brain affected in these patients of phenylketonuria, and that's why these patients have mental retardations. These patients will also be having seizures, right? Now coming to the treatment of phenylketonuria. In treatment, first is that you have to restrict phenylalanine in diet. Restrict phenylalanine in diet. And because phenylalanine we have to restrict, and lifelong restriction is required. Lifelong restriction of phenylalanine is required. And here aspartame artificial sweetener is contraindicated in these patients. Why it is contraindicated? Because this aspartame is a dipeptide. Dipeptide means made up of 2 amino acids. It's not 2 peptide bond. It is that dipeptide means it is made up of 2 amino acids, and the 2 amino acids are aspartate, and phenylalanine. So we have to restrict phenylalanine to these patients. That's why aspartame artificial sweetener is contraindicated in these patients, right? Now, second line of treatment is that we have to give tyrosine to these patients because tyrosine becomes essential now, and we also should be giving tryptophan to these patients because why brain is affected? I told you that tyrosine and tryptophan are not reaching the brain. So when we are giving more of tyrosine and tryptophan and we are restricting phenylalanine in the diet, then these amino acids, tyrosine, tryptophan, will enter the brain cells, right? In the treatment also we can give supplement of tetrahydrobiopterin. Tetrahydrobiopterin supplementation can be given especially for treating non-classic phenylketonuria, and this tetrahydrobiopterin load test is a test which is done to distinguish between classic and non-classic phenylketonuria, right? Now next, coming to the uses of tyrosine. There are three main uses of tyrosine. Tyrosine is used for the synthesis of catecholamines. Second, for the synthesis of thyroid hormones. And third, for the synthesis of pigment melanin. So let's take them one by one. First, I'm going to take the synthesis of catecholamines. So let's see this catecholamine biosynthesis pathway in detail. That is catecholamine biosynthesis pathway. So which amino acid? We have tyrosine as the precursor for the synthesis of these catecholamines. You know that this tyrosine is coming from which amino acid? Phenylalanine, with the help of enzyme phenylalanine hydroxylase enzyme here. Now this tyrosine will be converted to next intermediate, and here also some hydroxylase enzyme is there. Which aromatic amino acid hydroxylase will be used here? Good, that is tyrosine hydroxylase which will be used here, and this tyrosine hydroxylase is the rate limiting enzyme in the synthesis of catecholamines, right? So after tyrosine hydroxylase, what is formed is DOPA, L-DOPA. What is the full form of DOPA? DOPA is dihydroxy. You can see why it is dihydroxy, because one OH group is added by this hydroxylase, phenylalanine hydroxylase. Other OH group is added by tyrosine hydroxylase. So it is dihydroxy phenylalanine. Right? So we are just adding two hydroxy groups in phenylalanine and it becomes L-DOPA, that is dihydroxy, two OH groups and phenylalanine. Very simple, right? So this L-DOPA is considered as the precursor of all catecholamines. L-DOPA is considered as precursor of all catecholamines, and now DOPA will be taken up by next enzyme, DOPA decarboxylase. Here carbon dioxide will be removed and it is a kind of simple decarboxylation. I told you there are two types of decarboxylation, simple and oxidative. So here it is simple decarboxylation, and I told you that in simple decarboxylation the vitamin which is required is B6, right? So now see here what is happening after decarboxylation. You can consider DOPA, L-DOPA is a kind of amino acid. So from amino acid, when we are removing acid or carbon dioxide, we are removing acid. So acid is removed and we are left with amine. So now this compound is known as dopamine. See the name amine, because after removal of carbon dioxide from amino acid, amine is formed, so called dopamine, and this is the first catecholamine which is synthesized. It is the first catecholamine which is synthesized. Now next enzyme is dopamine hydroxylase. Next enzyme, dopamine hydroxylase. You can see many hydroxylases are used here in this pathway. Again we have one hydroxylase, and that is dopamine hydroxylase. This hydroxylase requires vitamin C. Many hydroxylases require vitamin C. If you remember, in collagen synthesis, there are prolyl and lysyl hydroxylases, and they both require vitamin C. So here in catecholamine synthesis pathway, dopamine hydroxylase also requires vitamin C. and by this hydroxylase enzyme, dopamine gets converted to norepinephrine, which is the next catecholamine is formed, and this norepinephrine is formed where? It is formed in sympathetic ganglia. It is formed in sympathetic ganglia and nerve endings, right? Now, this norepinephrine will be converted to epinephrine, and here in the conversion of norepinephrine to epinephrine, we have to add a methyl group, and who will give this methyl group? SAM will give this methyl group, that is S-adenosylmethionine will give this methyl group, and the name of enzyme here is phenylalanine N-methyl transferase. See, the name of enzyme is methyl transferase because methyl group is getting added in this step, right? And this conversion of norepinephrine to epinephrine does not occur in central nervous system. It will occur only in periphery. It will occur only in periphery, not in central nervous system. And 80% of this synthesis of epinephrine will occur in adrenal medulla. It will occur in adrenal medulla. So question was asked that which catecholamine has a methyl group? Which catecholamine has methyl group? Epinephrine has methyl group. Which is the first catecholamine which is formed? That is dopamine is the first one which is formed. And the catecholamine in sympathetic ganglia nerve ending is norepinephrine, right? This catecholamine synthesis pathway, which we have done, has organ specific termination. Depending upon the organ, specific termination will be done here, right? Now, in the catabolism of these catecholamines, we require two enzymes, COMT, MAO. What are the full forms? This is catechol O-methyl transferase. And what is this MAO? It is monoamine oxidase. One thing important here is in catabolism, you have to learn the catabolic end products of these catecholamines. See here, the first one is dopamine, then norepinephrine, then epinephrine. The catabolic end product of dopamine is homovanillic acid. The catabolic end product of norepinephrine is VMA, that is vanillyl mandelic acid, and catabolic end product of epinephrine is metanephrine. It is metanephrine, and metanephrine can be converted to VMA. So this VMA is the major catabolic end product of catecholamines, right? So clinically this VMA is important. VMA stands for vanillyl mandelic acid. This VMA levels are found to be increased in pheochromocytoma. Pheochromocytoma is tumor of adrenal glands. It is tumor of adrenal glands, and in pheochromocytoma the patients have headache, palpitation and profuse sweating, right? So this is pheochromocytoma. And other disease where VMA levels are found to be increased is neuroblastoma of adrenal glands. It is neuroblastoma of adrenal glands. Clinically, VMA is found to be increased in these two diseases, and in the diagnosis, 24-hour urine sample will be collected, and then in this urine sample, VMA levels will be measured. Let me tell you, the normal VMA levels are 2 to 6 milligram per 24 hours. That is 2 to 6 milligram per day, right? So this was one use of this amino acid tyrosine. Another use is synthesis of thyroid hormones. So what will happen? This amino acid tyrosine will be taken. One iodine added here. It is called monoiodotyrosine. That is MIT. In this monoiodotyrosine, you add one more iodine, and this becomes diiodotyrosine, that is DIT. Now this MIT and DIT both are taken to form T3 and T4, that is triiodothyronine, and this T4 is tetraiodothyronine, or also known as thyroxine. So this amino acid tyrosine has very important role in the formation of these hormones, that is thyroid hormones, right? So now the third function of tyrosine, that is synthesis of melanin, the pigment melanin. Let's see how it is synthesized. So amino acid tyrosine gets converted to dopa. Again dopa. Earlier the enzyme from tyrosine to dopa was tyrosine hydroxylase, but now here the enzyme is not tyrosine hydroxylase, the enzyme is tyrosinase. You know, tyrosinase is an oxidase, and any oxidase requires copper, so this tyrosinase also requires copper, and now this dopa will be converted to the pigment melanin. Here also enzyme is tyrosinase, it is converted to pigment melanin, and this melanin gives pigmentation, it will give pigmentation to hair and nails, and this enzyme tyrosinase is synthesized in melanosomes, which are present in melanocytes of skin and hair. You know that deficiency of this enzyme tyrosinase, the disease is albinism. In albinism, the patient has milky white skin, white hair, and red eye color. In phenylketonuria, it was fair skin and blue eye color, but here it is milky white skin, white hair, and red eye color. Now tell me, what is the difference between albinism and vitiligo? In albinism, this enzyme tyrosinase is absent, but what is vitiligo? In vitiligo, the enzyme tyrosinase is normal, but what is the problem here is that there is lack of melanoblast. There is lack of melanoblast in regional areas where pigment is absent, so that is vitiligo. So there is a big difference between albinism and vitiligo, right? Now you have seen the conversion of this amino acid tyrosine to dopa with the help of two different enzymes. Tyrosine to dopa conversion can also occur with tyrosine hydroxylase enzyme, and it can also occur with the help of enzyme tyrosinase. When it is tyrosine hydroxylase enzyme, then it is used for the synthesis of catecholamines. When it is tyrosinase enzyme, then it is used in the formation of pigment melanin. So these two enzymes are synthesized in different cells of the body. This tyrosine hydroxylase enzyme is synthesized, or it is present in adrenal medulla, sympathetic ganglia, and nerve endings. And on the other side, this tyrosinase enzyme is present in melanocytes, or it is present in melanosomes, right? Now, I have given you the uses of tyrosine, but I have not told you any use of phenylalanine. Why? Why I have not told you any use of phenylalanine amino acid? Because there is only one work of phenylalanine in body, and that is formation of tyrosine. That's it. It will not do any other work in the body. So what is happening, that from diet we are receiving this amino acid phenylalanine. Phenylalanine will be converted to tyrosine, and now tyrosine is important amino acid in the body which will do so many functions like catecholamines, pigment, and thyroid hormones. And finally this tyrosine will be catabolized and thrown out of body. So this is all occurring in a sequence. So can I say that the catabolism of phenylalanine and tyrosine is same, right? Now let's see the catabolism of phenylalanine and tyrosine, because they have same catabolism. Catabolism of phenylalanine and tyrosine. So you know that from phenylalanine, tyrosine is formed with the help of enzyme phenylalanine hydroxylase. You know, in the catabolism, the first step is transamination. So here the name of enzyme is tyrosine transaminase, and the deficiency of this enzyme will lead to type 2 tyrosinemia. So after transamination, after transamination, amino acids gets converted to the keto acids. So now we have para-hydroxy. At para position, hydroxy group is present in case of tyrosine. So it is para-hydroxy phenyl pyruvate. Phenyl pyruvate. Why phenyl pyruvate? Because this is phenylalanine. By transamination, alanine amino acid will form pyruvate. So when here it is phenylalanine, then it is called phenyl pyruvate. And the short form of this is para-hydroxy phenyl pyruvate, which is a keto acid. Right? Now this PHPP, para-hydroxy phenyl pyruvate, is taken up by next enzyme, that is PHPP hydroxylase enzyme. PHPP hydroxylase enzyme is there. Now complete deficiency of this enzyme is also there, and partial deficiency. Complete deficiency will lead to type 3 tyrosinemia, and partial deficiency will lead to Hawkinsinuria. And these patients of Hawkinsinuria have swimming pool like odor. And this reaction, PHPP taken up by PHPP hydroxylase, this reaction will form homogentisic acid. And the next enzyme after homogentisic acid is homogentisate dioxygenase. That earlier this enzyme was called homogentisate oxidase, but now the new name of this enzyme is homogentisate dioxygenase, because this enzyme is incorporating 2 atoms of molecular oxygen into the substrate. And here this enzyme also requires iron. And you also know that the deficiency of this enzyme will lead to L-captonuria. Deficiency of this enzyme will lead to L-captonuria. There is a drug used in the treatment of L-captonuria, which is inhibiting this enzyme PHPP hydroxylase, and that drug used is nitisinone. Nitisinone is inhibiting this enzyme, so homogentisic acid will not accumulate in these patients of L-captonuria. So nitisinone is used as a drug in the treatment of L-captonuria, right? So let's continue the pathway. After homogentisic acid, what is formed is mallyl acetoacetate is formed. Now this mallyl acetoacetate is taken up by isomerase enzyme, and this isomerase enzyme requires glutathione. GSH stands for glutathione, and one question was asked that glutathione is required in the catabolism of phenylalanine and tyrosine pathway, right? So after this isomerase enzyme, here fumaryl acetoacetate is formed. And now this will be broken down. Fumaryl acetoacetate will be broken down by enzyme. The enzyme name is fumaryl acetoacetate hydrolase. And deficiency of this enzyme is type 1 tyrosinemia, and by this enzyme what is happening is that this fumaryl acetoacetate is getting broken down to fumarate on one side and acetoacetate on the other side. When it is broken down to fumarate, which is a TCA cycle intermediate, because this amino acid is forming TCA cycle intermediate in the end, so therefore it is glucogenic amino acid. And when acetoacetate, that is a ketone body, is formed, so it is ketogenic amino acid. And the catabolism of phenylalanine and tyrosine is same, so I will say that both phenylalanine and tyrosine are in both category, that is, they are glucogenic also, they are ketogenic also, right? Now let's do the detail of these diseases. L-captonuria first, and then I will be taking tyrosinemias. So first is L-captonuria. I'm going to take L-captonuria. The enzyme deficient is homogentisate dioxygenase, the enzyme which requires iron, and treatment is nitisinone drug is used here. And here the substrate which gets accumulated. What is the substrate which gets accumulated? That is homogentisic acid, or homogentisate is accumulated, and this homogentisic acid gets oxidized. When it gets oxidized, it will form black colored compound which is coming in urine. So urine of these patients turns black on exposure to air. If they ask you the fresh urine of these patients will be absolutely normal color, but on standing this will be converted to black colored urine because of this oxidation of homogentic acid which is coming in urine of these patients, right? You also know that L-captonuria is a part of Garrod's tetrad. In Garrod's tetrad, the 4 diseases which are there is cystinuria, L-captonuria, albinism, and pentosuria. So L-captonuria is one of the disease of Garrod's tetrad, right? The age of onset of these patients is around 30 to 40 years, and mainly patients present with lower back pain because bones are also affected here. And these patients do not have any mental retardation. There is no mental retardation. Age of onset is 30 to 40 years, and in these patients after a few years what will happen that this homogentic acid is also getting accumulated in body, and it gets polymerized to form L-capton bodies. Which get accumulated in cartilages and connective tissue of these patients, so that the connective tissue of these patients will be giving bluish black appearance. Especially it will accumulate in nose cartilage, the ear pinna, intervertebral disc, and that's why the patients have back pain. And after some time this will lead to arthritis also, and this accumulation of homogentic acid in the body is known as ochronosis. So it is also called, the arthritis which occurs here is also called ochronotic arthritis, and these patients have ochronotic arthralgia. One very important point here is that in the diagnosis, Benedict's test will be positive in these patients. You know, Benedict's test is for reducing substances. Homogentic acid is also a reducing substance, so Benedict's test will be positive in these patients, and the diagnosis is done by the ferric chloride urine test, which is positive in these patients, right? Now coming to tyrosinemias, I told you there are 3 types of tyrosinemias. Type 1 tyrosinemia is also called tyrosinosis. This is the most common tyrosinemia which is occurring, and this is also known as hepatorenal tyrosinemia. The enzyme which is deficient in these patients is fumarate acetoacetate hydrolase, which is the last enzyme of this pathway, that is fumarate acetoacetate hydrolase, right? Now type 2 tyrosinemia is also known as oculocutaneous tyrosinemia. Here eyes and skin are affected. The enzyme which is deficient here is tyrosine transaminase enzyme, which is the first enzyme of this catabolic pathway. And here eyes are affected and skin is affected. When eyes are affected, mostly these patients have corneal ulcer, and because skin affected, so these patients have hyperkeratotic plaques. So this is type 2. Now type 3 tyrosinemia is because of enzyme deficient PHPP hydroxylase enzyme, and this is also known as neonatal tyrosinemia, right? So we are done with tyrosinemias, and we are done with these 2 amino acids, phenylalanine and tyrosine metabolism, right? This is it. Thanks for watching.